Hello, you guys. Here is another NCLEX style practice question presented by Apex Nursing Academy. The nurse is caring for a client after a bronchoscopy and biopsy. Which finding, if noted in the client, would the nurse immediately report to the primary health care provider? Now, anybody that knows Apex knows before we drop down to answer any question, we recognize our cues and analyze our cues. So let's get right to picking up our significant data. This question is talking about a client after a bronch and biopsy. They want to know which finding would we immediately report. This is where you go right into, you pick up your significant data from the question and you go right into analyzing your significant data. Bring all of your nursing knowledge to the forefront and start analyzing. What do you know about bronch? What do you know about biopsy? Um, a bronchoscopy is a procedure that is doctors use to view the airways and check for any abnormalities. They put the bronchoscope down into your lungs and they can go in and just check for any abnormalities. They can also perform a lung biopsy. You know, a biopsy is just removal of tissues. They remove those tissues and then they can examine the cells in those tissues. So bring all of that patho, all of that good nursing knowledge about bronchs and biopsy to the forefront of your mind. Think about post procedure because this client has had the procedure. It says after a bronch and biopsy. So think about things that you're thinking about when taking care of a patient post procedure. Bronch is directly related to the lungs. So, of course, airway is what we are going to be thinking about. Maintain the client in semi-fowlers. This client is not laying flat, right? Assess for gag reflex. Maintain NPO status, which is nothing by mouth. Maintain NPO status until the gag reflex returns. Check for bowel sounds. Now, post procedure, they may have hypo bowel sounds, but they do need to have some bowel sounds, right? They may have bloody sputum due to the procedure. It may be blood streaked, but it should not be bright red frank blood, right? Post procedure, remember, in post procedure times, we want to monitor and prevent complications. Signs of bronchial perforation, bronchospasm, hemorrhage, hypoxemia, pneumothorax. These are complications, and we want to be on the lookout for signs that some of these complications may be happening. We want to prevent them from happening, right? So now that we have that knowledge to the forefront of our mind, we've picked up on the data, significant data, we've analyzed it, we can go to the answer choices and just pick our best answer. Remember, we're looking for a finding that we will immediately report to the primary healthcare provider. So let's think about dry cough. Dry cough, are we going to pick dry cough as something to immediately report? No, because dry cough is expected post bronch. Hey, you've had a scope going down your throat to your lungs. You may have some cough. You may have some cough after that. So we're going to eliminate that answer. That's expected. Hematuria. Hematuria is blood in the urine. Blood in the urine, although it may set your alarm bells off, and you may say, hey, blood in the urine, I need to notify the doctor. But keep in mind that we're talking about a bronch and a biopsy, something that we're going to immediately report to the healthcare provider following this procedure. So we have to stay focused on our client, our scenario of what's happening. Hematuria is not related to that. It's not a related symptom of bronch or biopsy. So don't get caught up with, oh my God, it's blood in the urine. I need to report that to the doctor, because you have to stay focused on what's going on with your client. Remember, you want to stick with your significant data. Don't add to, don't take away. Stick to your significant data. So hematuria, though, In some way, hematuria may be something that the doctor needs to be notified about. It's not related to bronch right now. So we're not going to immediately note, we're not going to pick that answer. We're not going to immediately report that in this question. We're not going to choose that for our answer. Bronchospasm. Ding, 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 ding. Bronchospasm is an airway problem. Remember your ABCs? Airway problem, airway, breathing, circulation. Airway is always number one. So that, I mean, we can close the book, but we'll go ahead and look at bloodstreak sputum, which we've already established that bloodstreak sputum is expected in this context after a bronch. They have put a scope down your throat into your lungs. You may have some bloodstreak sputum, but remember, you don't want to have bright red blood, frank blood. Frank blood just means it's visible to your eyesight. You can see it. So if they are having a lot of bright red blood, that could be a sign of hemorrhage. That definitely would need to be reported. But in this case, it just said blood streaked sputum. That is expected. So I think we have an answer. Bronchospasm would definitely be the finding that we would immediately report to the primary healthcare provider, because that is an airway problem, and airway problems are a priority. Are you guys seeing how to tackle these NCLEX style questions? You can do this. Use your cognitive skills and remember to do daily questions. Do your daily questions. Look at the rationale. You will get better and better, and always use your cognitive skills. You all have a great day, and I will see you next time. Bye bye.